Hello and welcome to today's WorkSafe Month webinar, Managing COVID-19 in the Workplace, Just Another Hazard. I'm Stephanie Morawski from WorkSafe Tasmania and I will be your moderator. Before we start, please take a moment to read the following slide about information received today. I'll now go over housekeeping. Here is a screenshot of the attendee control panel. You should see something that looks like this on the right hand of your screen. You're likely listening in using your computer speaker system by default. If you would prefer to listen over the phone, just select telephone in the audio pane and the dial-in information will be displayed. Webcams and audience microphones will not be used in today's webinar. Questions will be taken at the end of the presentation. Please use the questions pane on your control panel to type and submit your questions. Finally, today's webinar is being recorded. I would now like to introduce your presenter, Brad Parker, Acting Director of Industry Safety from WorkSafe Tasmania. As the Acting Director of Industry Safety, Brad oversees the operation of the WorkSafe Inspectorate, Advisory Services Unit, Dangerous Goods, Licensing and Accreditation Unit, and the Contact Centre or Helpline. He has over 20 years' experience in workers' compensation, including managing the operation of the Tasmanian Workers' Compensation Scheme, and has also managed the Asbestos Compensation Scheme for Tasmania. In addition, Brad has spent 15 years working in injury prevention, performing various roles responsible for work health and safety across a range of industry sectors. Brad has held a range of engineering positions within the mining sector and holds various tertiary qualifications in engineering, health and safety, and public sector management. Brad has also been Secretary to the WorkCover Tasmania Board and is a non-executive director of the Personal Injury Education Foundation and a graduate of the Australian Institute of Company Directors. Welcome, Brad.
Good morning, everyone, and thank you for the opportunity to come along and talk to you today about COVID. So I'm assuming the technology is working because I can't see anyone, so this is a little bit odd, but I'll try and work my way through it. So today's presentation, what we'll seek to do is just to touch on COVID-19 in the context of being a workplace hazard and what controls should be considered as part of managing it as a workplace hazard. We'll briefly touch on masks and their use as a means of control. We'll touch on COVID-safe plans, which I'm assuming most or all businesses would have. Complacency is a bit of an issue, so we'll be just touching on that, and also having a little bit of a discussion around educating your customers or patrons coming into your workplace. We'll touch on outbreak management and what you should be thinking about in that space, and then if I don't talk for too long, there'll be times at the end for questions. So we'll kick off and see how we go. So 2020, a year to forget. That's certainly what a lot of people would say. So just looking at where we've come from and where we're at. Certainly March was where it particularly kicked off in Tasmania. We had a state of emergency declared. We had public health emergency declared, and we had public health directions issued. These are the things that control what we do and how we do things, and these continue to exist in today's environment, and they are regularly changed as our COVID situation changes. If you wish to have a look at those declarations and directions, they are available on the COVID or coronavirus.tas.gov.au website, and I would encourage you to keep across that because that provides all the latest information in regards to the specific requirements. Here we are now in October, and the question is, are we on the way out, or are we just starting down a very long journey? At this particular point in time, I think we're coming out of hibernation, and come late October, early November, the borders will reopen, and that will present us with a new series of risks. I'm not convinced that we're out of the woods yet, and as a workplace we need to be ever vigilant to make sure that we're actively managing our hazards and implementing our COVID-safe plans moving forward. Or put it another way, just because you may be over it doesn't mean that we are over it. So we'll talk a little bit more now around excuse me, how we start to manage some of our issues. So obviously, work health and safety legislation applied to all workplaces in Tasmania, and as a part of that, there's a requirement to manage hazards, a hazard being something that can cause harm. So COVID-19 is something that causes harm, and as a consequence of that, it needs to be managed. It needs to be managed in the same process or same mechanism that you manage any other hazard in the workplace, by assessing the risks, i.e. the likelihood and consequence of an event occurring, and then controlling the risk by applying the hierarchy of control. And there's obviously a broader obligation by on the PCBU to make sure that those hazards in the workplace are managed and the risk reduced as to so far as is reasonably practical. Therefore, reducing the risk of COVID infection in the workplace needs to be actively managed, and it also would be or form part of a PCBU's risk register at this time, until it becomes an issue that may we've got a vaccine or we've got some other process in place to stop it being an issue within our workplaces. So that's the legislative framework from which we deal with COVID-19. Then we start to look at how we control it. Now, this is where it gets a little bit more complex from the point of view that we have the public health directions versus a hierarchy of control. So the public health directions are issued under the Public Health Act of 1997, and they specifically say that we need to keep 1.5 metres apart. We mustn't have any more than one person per 2 metres per square metre of density in any particular place. We need to limit the amount of mixing we do, and we do this by sitting down to consume food and alcohol. And obviously hygiene is a key component, washing our hands frequently, using sanitizer and the such. So they're all mandated under the public health directions. We then have the Work Health and Safety Act and regulations that specifically identify the hierarchy of control. So, and the normal process for managing a hazard. Can we eliminate it? If we can, then it's gone away and we don't have a problem. Can't really do that with COVID-19 at the moment. Can we isolate it? Well, this is where we're starting to put some separation areas in, substitute, not really engineering controls, are a little bit vague in this space, that we're really getting down to administrative controls and PPE. So I think the things that are identified under the requirements under the public health direction form the basis from which our administrative controls that we see in our COVID safe plans apply. But the key thing out of it is we've got to be able to demonstrate that we are managing both. And obviously PPE being the lower order of within the hierarchy of control is something as a last resort, but it's also something that we need to recognise is an effective control, particularly when we are dealing with COVID-19. I'll digress slightly and just talk a little bit about masks. So the public health advice or public health typically adopt a medical model in respect of using masks. So they're used in only specific situations, and they tend to strongly support the use of surgical masks. Surgical masks are good for protecting others from any infections or any fluids coming from the wearer. And we've seen a little bit of movement worldwide over time. It was a little bit slow to get traction, certainly in Europe and the US. They're very big into the use of masks. And obviously we're seeing with Victoria and their experience that they're heavily relying on masks. So I suspect that if we move into a second wave, or we start to think about what the future looks, having a supply of masks or being able to get access to masks if this thing takes hold again and causes us some more grief, then it's certainly something that all workplaces should be considering. And putting that within a context of the work health and safety approach, typically PPE is the last form of protection, but we put PPE on people on a daily basis, so it's not that necessarily that uncommon to see people wearing respirators and providing protection in regards to that space. I think there are some requirements that need to be followed as part of that, and I'm sure most workplaces would be aware of them, but if you are going to go down the masks, they need to be suitable for the situation that you're intending to use them for. So typically, a surgical mask, as I mentioned, protects the people around the wearer, whereas if you go to a P2 or an N95, you typically are protecting the wearer as well as the people around the wearer. So they have a slightly different focus, and you need to be clear around what how and what you're seeking to achieve in that space. Obviously, fit is important. They don't work if you're using them to protect the wearer if they're not fitting properly, and this typically means that you need to be clean shaven in order to get a good seal around the face. You need to understand who you're trying to protect, i.e. the person that's wearing it or the person that's associated with the wearer, and you also need to make sure that there is training provided. This is a requirement under the work health and safety regulations, and so wearers need to know what they need to do and how they should wear them and fit them and manage them correctly. And that will typically go to having a procedure that works through all the requirements around the use of PPE, and that includes the disposal and how to remove them. Now, given the nature of COVID-19, where it sits on the surfaces of things, including masks, protocols around removing masks where there is potential exposure are quite important, and the PCBU needs to be across those and make sure that the people that they're giving the surgical mail or the mask to have a clear understanding of the way to put them on, take them off, and dispose them in an appropriate manner. So moving on to so where we're at and what the broader framework is. So the government at the height of the pandemic introduced the concept of a COVID-safe framework, and that seeks to work through a number of different components, one being minimum standards, which are defined by the public health directions. The next one is WorkSafe or workplace guidelines in regard to how to manage the risks associated with COVID-19 within the context of a specific industry sector. So on our website, I think we have 54 different guidelines, all focused on specific industry sectors that will provide people with guidance around the sorts of things they need to be considering as part of their COVID controls. And then the final component was the requirement for all businesses to have COVID-safe plans. Now we're a long way down the track in respect of COVID-safe plans and the guidelines, but they are still a relevant resource for businesses, particularly those businesses that have been in hibernation for an extended period of time. But it's appropriate to recognise the importance of having an up-to-date COVID-safe plan so that a business is prepared and able to reduce its risks associated with COVID-19. And I'm going to spend a little bit more time on talking about that now. So COVID-safe plans are, as I said, every workplace should have them. If you don't have one for your workplace and you need some assistance, and give our contact centre a call, it is important that every workplace has worked through what they need to do in regards to keep their people safe, or their workers safe, as well as their customers. We've provided some templates in regards to what a COVID safe plan should look like for a small to medium-sized business, but we also recognise that it doesn't necessarily have to be in the form of our template, and most businesses that have a good safety management system clearly have a risk management process, and COVID, as we've suggested, is just another hazard that needs to be and should be managed in the same way as any other hazard within the workplace. I think there's a level of the plans need to be based on the risks that apply. There are minimum standards which we've touched on in regards to the public health directions, but there also needs to be a clear understanding of what the risk profile is within the business. And that means working through how people interact with your business, where are the points of higher risk, and what controls are in place in order to make sure that those controls are being applied effectively. The content, as I said, needs to be based on risk, and you need to make sure that the minimum requirements are being satisfied, but there may be additional processes and systems that can be applied in order to assist you in getting the risk down to what could be considered an acceptable level. I think the key thing that we need to recognise where we're at now, plans were typically developed in April, May. We're now here in October. I think it's fair enough to say that there is a perception that the risk at the moment is pretty low. The moat's been up for a long period of time. We haven't had people coming or crossing our borders for a long period of time. We've had some small numbers, but not a large volume, and we're travelling pretty good in regards to our overall broader COVID risk. But unfortunately, COVID moves very quickly, and as of the 26th of October, we'll see our borders open, and we need to be constantly reviewing our plans to make sure that they are able to be adapted to accommodate the change in the external influences that exist at a particular point in time. I was having a conversation with a colleague this morning in regards to the way we view COVID safe plans, and specifically the means by which they are able to mitigate the risk from the PCBU's or the business's perspective as we open the borders up. So the borders go up, or come down, I should say, and we get people coming in from other states. Potentially the risk increases. But if you've got your COVID safe plan and it's actively being applied and the rules are being clearly communicated to the patrons, and you're doing everything you need to do to implement that plan, then you're actually reducing the risk profile of your organisation. And it's really quite important to recognise that it's really now, this is the time that your plan will be of most significant value to you as we start to move into a new dimension of the COVID or the new COVID norm, as some are describing it. So one of the challenges in all this space is it's not just what the businesses are doing, it also needs to be successful, we need to rely on our customers, the patrons, our contractors, and the people that come into our workplaces. We need to make sure that they are have an understanding around what your requirements are, and making sure that people are doing the right thing. This typically means that you've got to provide information to them. You need to communicate your requirements and make sure that you've defined what the behaviour expectations are of those people coming into your workplace. And if people do not choose to want to comply with them, then obviously you've got an obligation to enforce the rules to keep your workers safe and to keep your other customers or clients safe as part of your broader work health and safety obligation. One of the things that it's really quite a strong selling point for businesses to be able to say that the reason why they are implementing these controls are to ensure that the clients and people that come into the workplace are safe, and a lot of businesses are using it as a means to get some leverage in regards to making sure that the people are confident that come into their workplace that they're not going to be exposed to risk, and vice versa. If you have a person or an individual who goes into a workplace and they determine that the COVID controls are inadequate, there's lots of people in there, they're moving around, they're not following the rules, and the obligation there is also to step out of that environment and make sure that you go to another business. If you believe that you're being exposed to a risk, then make sure that you take the time to tell the business that's what your view is, but also take your business elsewhere and find businesses that are more attuned to making sure that the controls that are in place are actively being applied. And we're seeing more and more of this in the of complaints coming in where people are going into various businesses. We see it in in a lot of businesses at the moment, that the controls that were in place back in April, May, June have dropped off quite significant. People have become a little bit lax in their controls, and we are seeing complacency starting to sneak into the way we are doing things. And this is all part of getting starting to address the issues or the challenges around complacency more broadly. Yes, the risk is low. We haven't had any cases for a long period of time, and people suggesting that we're over it, it's all finished with, and all the rest of it. But you've only got to look to outside of Tasmania to Victoria, and outside Australia to New South Wales, to the US, Europe, UK, going back into lockdown. So the probability is that that's something that we may find ourselves confronted with into the future, and we need, as a community and also as individual employers, be actively working in that space to try and avoid that from occurring. As I mean, complacency is very much about an awareness or an unawareness of actual or perceived risks. And unfortunately, we're seeing a little bit of that happening and that's driven by it won't happen to me. We have a good plan, everything's travelling all okay, there's no COVID in the broader community, the perception is low, the desire to maximise income and to compete and get back to normal because we're all a bit over it all. They're all the things, and they're natural human behaviour. But what we need to understand is that complacency with COVID-19 risk can kill, the same as they do for any other workplace hazard. We see it on a regular basis where people become complacent with working at heights or guarding on machinery or any other workplace hazard, and when someone has an incident, it all becomes very real very quickly in regards to the impact of what complacency can have. I think it's worthy of looking at the broader picture. Certainly these numbers were as of Saturday when I was pulling this presentation together, but you can see that within Australia we've had 27,000 cases, we've had 900 people die, 13 of those were Tasmanians, and we are now in that situation where our borders will be reopening, and whilst we recognise that a lot of the people who will choose to travel around the country will come from states that have a low COVID rate, we are still potentially, there is the opportunity for people to spread the virus around when they come into the state, and we need to make sure that we've got the appropriate controls in place to protect that. So if we look at some numbers, you start to see that, this is hardly a picture that suggests that we've got control of this virus. It's quite the opposite. It's running way out of control with regards to the number of cases on a regular basis. They're creeping up. So I think whilst we in Tasmania believe that we don't have a problem, when you look at it in the context of what's happening worldwide, it's a false sense of concern or false sense of assurance that we've got this thing beat. The other side of it, of course, is that we've got 36 million cases worldwide, and confirmed new cases identified in the last 14 days of 4 million. The rate of increase across the world is significant, and if we think that we're going to be immune from that, I think we're kidding ourselves. So that's just reinforces the need that the COVID-Safe plan is the protection for your business, it's the protection for your staff, and it's the protection around making sure that we've got we can try and survive and continue to operate in a COVID environment. Moving on, the death rates, obviously these are the scary bits and the bits that become very unacceptable. But we've had over 1 million people die as a result of this virus. 13 of those are Tasmanians. Victoria's had its second wave. I'm not sure that we can sit back and say that we've got this thing beat by any stretch. So in the absence of that, we need to make sure that our COVID-Safe plans are our protection, and we need to be reviewing them now. We need to be reviewing them on a regular basis as things change, and we'll see more and more changes coming out over time as we try to, or as the government and the community start to change and release some of the restrictions that are currently being applied. There are times when you need to trigger a review of your COVID-Safe plan to make sure that you've got everything squared away and your business is protected. Things that you need to consider is, how will you know if you've actually got a case or how many cases in your business? What will you do to respond? So if one of your workers rings up and says, "Oh, I've gone off for a COVID test and I've been positive," how will your business respond to that situation? Have you thought about it? Do you have a plan in place? How will you keep your workers and contractors safe? So are those controls that you put in back in May and they've become a little bit lax and the sanitisers run out and we're not too worried about how many people we've got coming into the business? How's that going to stand once the borders open? What's the plan if your business does get infected? Do you just close it down, or do you try and keep operating? What are your controls and the processes that you've built in order to make sure that there is an ongoing viability of your business moving through? As soon as you get a case, then there's going to be a lot of pressure on the business to do contact tracing. And so what information do you keep around who deals with the various customers coming in, who deals with what staff members within your workplace? Where do they go? What do they see? What are the where are their interactions? What do they touch? They're all things that will be questions posed to you as a business should you have an outbreak. How will you communicate with the various players? You've got customers, are you continuing to operate? You've got workers who want to know information, whether they've been exposed, whether they've got to go into isolation. So there's a whole range of things that you should be taking the opportunity to work through now whilst we are in a particularly good position, in order to make sure that we're prepared and able to respond as things change in our community. The other thing is, obviously, do your people know what to do if there are issues? And even down to no one's immune from this. So if the leaders within your organisation all of a sudden get sick, or your executive team are all taken out of the business, what's the impact of that on your business? How will you deal with that? What will be the consequences of that? These are all things that we encourage businesses to think about, and we've been working with a range of businesses that are around outbreak management plans, and some businesses are doing an exceptionally good job in this space because they realise that the consequences of not managing it or getting a case will basically have a huge impact on the bottom line or close the business. You know, the inability to respond appropriately and the reputational damage and the consequences of not being able to continue to operate because of COVID are significant to a lot of businesses. And I've seen COVID safe plans that document or establish procedures that clearly identify what activities occur within a half-hour period. So the whole response plan is broken up into half-an-hour intervals, and within those half-an-hour things need to occur. Why? Because an outbreak management plan needs to be rapid, safe, and effectively isolate and manage cases as they present. There's rapid identification of close contacts. You know, the quicker the business can help public health get on and identify who's been in contact with the people who've tested positive, reduces the impact more broadly across the community as well as your business. So if you've got a large business and you've got lots of employees, then being able to identify and manage those contacts is really quite important. And it also leads to, or starts to lead to, the way the business can operate. We've seen lots of businesses move into working with bubbles where they have a team of people and that team goes in and performs their functions, but they don't cross over and mix with other teams. You don't get everybody coming into a tea room at one particular point in time. So there's a really strong and well thought out process to keep particular areas quarantined and to reduce the mixing. So in the event that there is an outbreak, the impact on the business is able to be minimised and reduced. The investigation of the source of infection and identify how it was came into the business and to try and reduce the impact of that is really quite important. So again, you can start to see rapid quick identifications, safe quarantine of close contacts. So you obviously, if you've got people in quarantine, they're out of the business, you've got to make sure that they're traveling okay. You've got to, you know, this potentially could be half or a quarter of your workplace or your entire workplace. So there's a whole range of things that need to be identified as part of the outbreak management preparation process. Supporting people in making sure that they're travelling okay, because at the end of the day you need them to get well and get back to work so as your business can get back on its feet and move beyond it. And obviously ensuring that as the introduction of the virus into your workplace, then obviously the COVID safe plans that you've developed need to be ramped up to the maximum in order to minimise the impact of the virus. So increased hand cleaning across the workplace, making sure that the workplace is not continuing to infect or spread the virus. And things like restricting the movement of people and those sorts of things are all part of what you typically see in an outbreak management plan. Now, the Health Department or Public Health have developed a bit of a model in regards to the things that you should be considering. So prevention in this space is very much about your COVID safe plan, but then we're talking about planning for cases. So this is our outbreak management, infection control preparedness, communicating when you've got an outbreak, managing the cases, enhancing the infection control and facilities management are all part of the process of responding to an incident, and then getting back into, you know, reigniting your business and getting back on track is all part of the overall process. Now, there's a whole lot of information available within the space, which I would encourage you to get hold of. Because, and I'll talk a little bit more about that as we move forward. But when you start to consider your business and what sorts of things that you may need to think about, what needs to, or procedures you need to put in place, you need to recognise, you know, who does in the event that there is a case, who will do what and when. So clearly getting down to who's got responsibility, what will they do, when will they do it, and how will it play out. It also goes to the communication. So who will say what, when, and who needs the approval, because you get into a situation where public health will come into your business in order to manage the outbreak from the point of view of trying to reduce the spread more broadly across the community. But any business needs to also continue to operate to deal with the and have plans in place that align with those actions of public health. How do you manage the infected person and the quarantine area? So how do you limit the impact of this into your business? And if you know where the person's been, then you obviously need to start to try and reduce the interaction between people into those areas. You also need to know where these people have been, what information do you need to be able to pull out, because that'll be the first question that public health will ask is, okay, who is this person and who have they been in contact with? And you need to be able to pull out information. And what you find is, as you start to think about this, you've got lots of systems and processes, and you've got security videos, you've got sales invoices. All these things potentially are all sources of information that will build a picture around working out who has been in contact with the person that's actually been impacted by the virus. Continuity planning is key. Are you going to continue to operate, or you just put a sign on the door saying closed? It's all part of working out, if you get one case, you're probably able to continue to operate. If you get 10 cases, you're starting to maybe question, depending on the size of the business and the resources within the business. If you get to 20 or 30 cases, it may be you shut the door and it's got to be managed and cleaned from end to end in order to reduce the risk and part of that process. So it's an understanding around how we or how this will impact on you as part of the as the virus enters your workplace, and how many people are impacted by that. That cleaning is a major issue. Obviously, as you've got a case, then you've got to work through what does the cleaning look like. Do you have enough products? I mentioned earlier on about using masks and making sure. So it may be that as part of your preparing you get in supplies, cleaning products to make sure that you've got it squared away in regards to being able to disinfect the workplace. Make sure that you've got the right type of chemicals and people are aware of the safe way to use them. It may be that you need to have a list of additional cleaning contractors to bring in as part of that process, because you're not going to be able to bring your workers back into that workplace until you've obviously cleaned it up and the risk of infection is no longer present. And then, as I said, when do you get the all clear to start to integrate and get people back into the workplace? What does that look like? Obviously testing and making sure that the people are safe as they move back into that environment is all part of the role of considering and planning for an outbreak should it impact on your business. So as I mentioned before, there's a template plan available through public health. We've got guidance tools and a whole array of fact sheets and information which is available. And as you start to embark on the outbreak management process, I'd encourage you to have a look at that information and make sure that you're across some of the challenges. If you need additional help, certainly you can contact our contact centre or Business Tasmania. There's a range of various sources available to work you through that process. So in summary, it's not a time to be complacent. It's actually the time to be making sure that you've got all your plans and your processes and your plan ready to and fully implemented. The 26th of October, we'll see a new dimension in this space. We will be seeing some changes in some of the restrictions that we currently have in regards to the number of people that can attend events and attend particular areas over time as we try to return to some form of normality. But I think the way to make sure that you continue to be able to operate as COVID potentially enters the workplace is very much, or enters the community, is very much around relying on your plan and making sure that it's being applied properly. Looking at it from the point of view that, is it, you know, you obviously created it, or you probably created it back in March, April, May, June. Do you need to review it? Are there some additional things that you can put in place in order to make sure that it's a more robust plan, that we've got sufficient supplies, and you're doing everything that you possibly can to ensure that your workers and customers are safe? Is it scalable? So obviously at the moment, I think we all have seen around various businesses that there's not a lot of rigour around the application. As the board has come up on the 26th of October, we would be encouraging businesses to be becoming far more vigilant in applying the controls. If all of a sudden we get community transfer and major outbreaks, then we would be looking at or expecting businesses to be becoming very rigid in regards to their controls. Otherwise, you know, the chances are that they probably will not be operating in the event that there is an outbreak and we're starting to see community transfer. Keep abreast of public health directions. This is not something that is a set and forget. It changes very quickly. There are various aspects to this this disease, and we've seen the impact of what it can have on our ability to do the things we want to do, just through looking at the Victorian experience. And what we're trying to do here is to not find ourselves in that situation where we've got to go into that level of reaction to or response to the disease taking hold within our community. As I mentioned before, communicate your expectations to your customer. This is not just a business's hold all the responsibilities. You've got controls that you want to apply. You need your customers to comply with those controls. You need to make sure that they understand what's expected of them and make sure they follow the rules. Ensure you have an outbreak management plan. You know, the plan doesn't necessarily need to be as complex as some that I've seen, but it's a matter of having a plan as to, well, if someone does get it, how will we react? And you work through those issues that I've identified earlier on. So it's a matter of just starting to think about the not, you know, won't happen to us, but if it did happen to us, what should we do? How are we going to respond? I think that's really quite important for a business in order to maintain that continuity of business. Ensure the controls are proportionate to the broader community risk. So keep an eye on the community, and you know, as we see cases pop up across the state, and we will get them. I think it's very naive to think that as we start to see people trying to return back to normal, that we aren't going to get outbreaks from time to time, but we need to be able to manage those. And I think that's part of the strength of our COVID safe plans is that, you know, you can, if you've got a good plan, then someone who has COVID should be able to enter your workplace and exit your workplace, and by applying your controls, not leave the virus in your workplace to infect your workers if those controls are working effectively. Ensure your plans align with your business continuity plan. So have an understanding around how you want to continue to operate, and make sure your plan, your COVID safe plan, assists to ensure that the continuity of the business in the longer term. And remember, you know, plan for the worst and hope for the best is the key motto in this space. We're in a situation where it can change very quickly, so we need to plan for that and the worst case scenarios. But hopefully, as the borders open and we've got all our controls in place and the COVID safe plans that each of the businesses and workplaces have put in place, will demonstrate that we can actually minimise the impact of this more broadly. So that puts us into question time, and I think it's back to Stephanie.
Yes, it is. Thank you, Brad. So we'll now take questions from the audience in respect to COVID management from Brad Parker. So please type your questions into the questions pane, and and Brad will respond to them. So a question that has come through, Brad, what advice can you give specifically around the use of screens or dividers where 1.5 metre distancing can not be met in the workplace? Is there a reference to a specified standard, and or how would we know what type of screen or divider would be considered a suitable control?
Okay, good question. If you apply the hierarchy of control, which we'll go back a step. The 1.5 is a mandated requirement where practicable. There are times when it is not practicable, so therefore you should then move into your hierarchy of control to start to identify what controls would be practical, and obviously you would get to an engineering or an isolation control where putting a barrier in place in order to reduce the transfer of bodily fluids. I think it's important to recognise that whilst barriers serve a purpose, they aren't a complete solution. So barriers, yes, they prevent the transfer of droplets that are being expired from the body from one person to another in close proximity. So they do have a role to play, and there is no specific standard that I'm aware of in regards to what or how they should be designed. I think it goes back to very much looking at the nature of your business, how you intend to use them, and in what context that they would apply. I've seen some horrific ones where you can't even communicate with the person on the other side of the screen, so you end up stepping around the barrier to try and communicate. So that's probably an example of not a very effective barrier to others that are able to reduce that risk. The other thing to remember with barriers is they need to be cleaned regularly, because obviously those droplets have to go somewhere, so they typically sit on the surface, and if the surface is touched, then there is the potential for that to be transferred across into and from person to person. So a frequent or a strong cleaning regime is important, and also, again, it depends on the nature and the risk, I suspect, is you may even wish to use them in conjunction with masks and those other as the risk increases. But as for the specifics of is there a standard that applies, no. What we are seeing more and more are businesses looking to try and mitigate or minimise their risk and using barriers. Some of them are effective, some of them not so effective, from the point of view that if you continue to put holes in them so you can hear, then potentially you've got the opportunity for the droplets to transfer through into others. So I think there's a level of thought needs to be put in place in regards to designing the way they intend to be used, given the activities of the business.
All right, thanks, Brad. Another question. You stated that a business needs to ensure compliance when a worker has been identified with COVID and is in quarantine. What compliance do we need to do?
Okay, so there's a couple of things there. One is that there's an obligation for the worker not to go back into the workplace. There's also an obligation from the business perspective not to allow people to come back into the workplace whilst they either have been put in isolation or whether they're waiting on test results as part of that process. So it's mainly around recognising that isolation is very much about keeping that individual away, reducing the risk of the spreading should they be proven to be positive, whatever the case may be. So the issue is that not letting them back into the workplace is the compliance component that you need to be quite attuned to as part of managing that risk.
All right, thanks, Brad. Another question. How likely would it be for a random visit from WorkSafe to a business to check a COVID safety plan?
Very likely at the moment. Since April this year, we've visited over 3,000 workplaces across the state, following up on COVID safe plans, following up on complaints, following up on issues that are brought to our attention. So we have a lot of resources allocated to making sure that businesses are doing the right thing. We are trying to work with business and educating them in regards to what sort of things they should be doing, and this is all part of that. But where you've got businesses who are choosing to completely ignore or flout the rules, then there are processes that will that we're able to apply. I think the other key thing in that space is that our activity in this area will also be directly proportionate to the broader community risk. So at the moment we're running a number of programs focusing on higher risk areas. We've been pretty active in the gyms area. We've done some work in outbreak management in larger organisations. We're about to kick off a program in retirement villages, and where there's potentially a higher risk given the nature of the patrons and some of the controls in that area. We're also working in seasonal workers coming in the agricultural area, the fruit pickers and those sort of areas. So we've got guys out there pretty much across all industries, but I also think that as we see the risk across the community more broadly increase, we'll be more active across a range of businesses to try and make sure that we're all in this together. And at the end of the day, it's important that we can minimise the impact of this more broadly. I don't think anybody would like to find ourselves in the same level of shutdown that the Victorians are just in the process of coming out of.
All right, thanks, Brad. There's another question that has come through regarding wearing a face shield. Can you talk a little bit more about who should be wearing a face shield? So what industry should be wearing a face shield? For example, is it mandatory for a community care worker to wear a face shield?
Yeah, a couple aspects to face shields. Within a medical setting, there's specific guidance around when they should or should not be worn. So where you've got the high likelihood of liquid transfer or being spread around in an environment, then obviously having a face shield protects the eyes and the ingress into the body. So that's one aspect of it. If you're talking about within the more broader setting, and again depends on the task being performed, there is no mandatory requirement that I'm aware of that says that if you're working in a community home or in a particular setting, within the public health directions, that face shields should be worn. In fact, there's no requirements in there in regards to the use of masks as well. But what you do or what you should be looking at is through your hierarchy of control, is there a risk that there is a potential for body droplets to be transferred from one person to the next? What is the context of that? If it is recognised that there is a need, then face shields are an option, the same as masks are an option. And again, it's very much specific in regards to the environment and the process and the task being performed. But I think it's important to recognise that there are a whole range of controls that are stipulated through the medical and the community sector that are different to that necessarily considered as part of the public health direction in respect of COVID and the work health and safety. So there is a slight difference there, and individuals would need to go, or the business would need to go back and look at what it is that's actually driving them to believe that face masks are, or face shields I should say, are a requirement, and if they're being used in conjunction with face masks.
All right, thanks, Brad. Question, what action can a PCBU take if someone, a worker or customer, refuses to follow the COVID safety plan requirements, such as physical distancing, hygiene, being in the workplace when sick?
Okay, so There's a few variations in that space. That the key thing from my point of view is that I don't think a lot of businesses are doing enough to educate their patrons and making sure that the requirements are clearly communicated. So I think if there's any opportunity to enhance the way you communicate those requirements, then a business needs to follow that. There are specific requirements under the public health directions in regards to persons entering a workplace who may be sick, or allowing people to work into or come into those areas if they are sick. It is a bit of a grey area from the point of view that just because someone's displaying symptoms doesn't necessarily mean that they have COVID-19, and the business needs to be clear up front as to what the expectations are, and then if they see non-compliance, then they should be asking the person to leave. If the person refuses to leave for whatever reason, then if it directly relates to a failure of the public health order, then police are able to come in and actually inject themselves into that space in regards to non-compliance with the public health direction. And if you've got people where you believe at risk, then you've got to continue to ask them to leave and seek to have the police involved if people are refusing to leave. At the end of the day, you have a broader obligation to your business, your workers and your other customers, and if people are choosing not to comply or placing them at risk, then if all else fails and you have been unable to encourage the individual to behave appropriately, then yes, you should contact the police and seek to get them removed from your workplace.
Thanks, Brad. A question in regards to construction sites. Do you have any suggestions for reducing risk as workers tend to need to work together, lifting, moving, etc.?
Yeah, construction sites can be a little bit of a challenge given the nature of the environment to which they operate. So I think there's a couple of things. You've got to go back to the beginning and start to say, well, what are the controls around making sure that the people who do come onto the site are actually safe? So it's those front end controls around educating people if they're not well or whatever the case may be, or they're showing symptoms, then they don't come to the workplace. It's a matter of then looking at making sure that they're using sanitizer and they're applying all the controls around reducing the transfer of the virus within that environment. The next phase of that is then to start to say, well, what are the tasks where we are unable to put appropriate controls in place or maintain the minimum standards, and then we start to look at alternatives in regards to administrative controls, PPE, and those more traditional control type measures. At the end of the day, there are times where you may not be able to do anything other than to put a person in a mask and put them with gloves on, and have them in close proximity if the risk is sufficient to warrant that. And we shouldn't be afraid to do that on the basis that if the risk and the assessment process that we've put in place and the controls that we've identified suggest that that's what's needed in order to manage that risk, we do it for dust in the workplace. We do it for chemicals in the workplace. This is just another workplace hazard that potentially can be managed through PPE as a last resort.
Are you there, Brad?
Yes.
Yes.
Yep.
Sorry, we lost you for a moment there. So we'll go on to we'll go on to another question. There are mixed views about temperature checks of clients. Are you aware of other workplaces conducting temperature checks on their client bases? Are they deemed a good indicator of a potential issue?
I think this is an area where you've got to take advice from public health. As generally speaking, I think just going out and buying a digital thermometer from the local chemist or whatever and starting to check people's temperature is not particularly useful nor helpful. I think if you're going to go down that path, then you need to seek appropriate medical advice around what the trigger points are and what reactions or responses are required should someone present with a higher temperature. I know a number of larger employers are using them across the state. I'm not sure to what success they have in actually identifying a problem. I think it's more of a screening tool in regards to potentially then allowing other steps to be taken in order to try and identify whether or not the person is risk. Using it in isolation, in my mind, is not appropriate. People have different temperatures for a whole range of different reasons. It's got to be built as part of a fully integrated screening process supported by medical evidence.
Thanks, Brad. Can you talk a little bit about masks on airlines? Why are the airlines not complying with social distancing requirements? When will mask wearing in planes become mandatory?
I have no idea. Don't control the civil or the aviation industry. I would suggest that this is where personal responsibility comes into play. And if I was going to be jumping on a plane, and it seems like a distant memory since the last time I jumped on an airplane, I would be taking my own mask and I would be making sure that I wear it in that environment. You know, we've got to take a level of personal responsibility here. And yes, if the airline provides them, well and good. I haven't had any examples. My understanding is that some airlines, or most of the airlines, were providing them, but I'm not sure how they were enforcing them. I'm kind of not really sure what the answer is here, but from a personal point of view, I would be making sure I've got my own respirator and I'm wearing it as I walk on the plane, and I take it off when I get off the plane or out of the airport after we've dealt with they are areas where you've got high volumes, you've got close proximity, you've got people coming from a whole range of different areas. Again, personal responsibility here is, do I want to be in this environment? If I do, then let's take some appropriate controls to actually manage our own personal safety.
Thanks, Brad. Could you please comment on community organisations which are not businesses in respect to COVID management plans?
So, yeah, there's a broader expectation across the community that COVID-safe plans will be developed in regards to those type of events. We encourage people to apply the same systems as they were, or if they were a business. It's a little bit more problematic in that it's underpinned by a or the health directions are very much focused on businesses and where there is a legislative framework. Community events typically it's good business to do it. Typically, councils will often require COVID-safe plans. We will be releasing in the very near future a events template for a COVID-safe plan, where we would be encouraging, whether it's a church fete or a community market or a scout group or whatever the situation may be, that they actually go through the exercise of developing their COVID-safe plan, communicating it with the people who are responsible for implementing, educating the people who come along to the event. It should be managed in the same way as you'd expect a business to in this case, because the virus doesn't care whether it's a business or a community event. It transfers people to people, and what we're trying to do is reduce the transfer of that more broadly within the community.
All right, thanks, Brad. And a final question, any guidance around short visits to a client's home where they are just greeted at the door and handed over an item such as pharmaceutical goods, groceries, meals, etc.? Is it okay to speak to the client face to face, or should items still be left at the door?
I don't believe there's any issue with talking to people, but again, it's managing the risk. So 1.5 metre distance, certainly you're able to have a conversation. We have conversations every day in a whole range of different settings, and I think it's that recognition that if you are going to get up closer to people and you want to protect them, then wear a surgical mask. Alternatively, as I said, maintain your distance. 1.5 is a minimum, but you can certainly stay 2 metres or 2.5 metres if it means you can have a conversation with someone who potentially hasn't had someone to talk to for a while. With regards to the transfer or handing prescriptions or medication or whatever the case may be, it's a matter of working out whether or not whether it's come from a chemist and you're handing it to the patron, to your customer, or vice versa. It's just a matter of recognising where the potential risks are, and if you need to clean things down or put on a pair of surgical gloves just to pick up the item, give it a wipe down with the appropriate disinfectant, and then it's good to go. Again, work out where those risk points are, and then work out what you need to be able to do in order to reduce that risk. But as for putting things on a step and walking away, I think one of the challenges we're all seeing is, mental health issues and people being in isolation. The ability to have that contact, but maintaining the social distances or putting a mask on are all very appropriate given our environment, and they shouldn't be seen. I think there's almost a level of stigma around, you're putting on a mask and you're promoting a level of hysteria. Well, that's not the case. All we're doing is trying to keep each other safe, and I think it's really important that we shouldn't be frightened to do that. And if it's a difference between having a conversation with someone who hasn't probably seen someone for a long period of time and would benefit from that interaction, I think it's a matter of going that next step and saying, well, okay, I'll have this conversation, but I still need to make sure that we've got appropriate controls in place so no one's put at risk.
Thanks, Brad. And finally, after using the HOC to access the risks, would you suggest that a customer-focused workplace use masks?
I think it depends on the nature of the circumstances. I've touched on masks as an effective means of as a control, and I think I've sent the message that we shouldn't be stepping away from that, but masks are something that we need to not just go out and buy and stick on and say, there you go, I've solved this problem. There's a level of controls, and as I mentioned before about the right type of masks, the way we use them, and those type of areas. At the moment, whilst we have no community transfer within the broader community, we don't have it in the state. I don't believe that that's necessarily a control that we need to be applying now. But if we start to see community transfers more broadly, I think you'll see, as we've seen in Victoria and a lot of other states, that masks will be the go-to control that I think lots of people will seek to use as part of that process. Can we mandate it for people coming into the store? I think you potentially could if the risk warranted it, but at the moment I don't see that there would be anything that would justify it at this particular point in time.
All right, thanks, Brad. And just in closing, you talked about COVID management plans and also about other templates available. Can you just tell everyone where they are able to find that information on the WorkSafe website?
Yeah, so if you go onto the WorkSafe website, we have a whole range of information in regards to guidelines, and we also, if you go into health and safety within there and either use a search engine, type in COVID you'll bring up all the different guides or scroll through the various selections. We have a range of guidance material also linked through to the coronavirus website, which is a Tasmanian government one. Really useful information in respect of that. Safe Work Australia also provide via their website lots of useful information around cleaning requirements and a whole range of other things. So one thing's for sure, as a result of this pandemic, there is lots and lots and lots and lots of information available across a range of different websites that that can help a business to prepare and respond to COVID. And if all else fails, there are a number of helplines available either through WorkSafe and our contact centre. Business Tasmania also run a contact centre, so we certainly are available to provide assistance as time goes by.
Thank you, Brad. So thank you, Brad Parker, Acting Director of Industry Safety from WorkSafe Tasmania, and thank you everyone for attending today's webinar, Managing COVID-19 in the Workplace, Just Another Workplace Hazard. Once you leave today's webinar, you will receive a survey on the presentation. We appreciate you providing us with your feedback. Today's webinar has also been recorded and will be made available at the end of WorkSafe month. On behalf of WorkSafe Tasmania and the WorkCover Tasmania Board, thank you for joining us, and thank you, Brad.